So the query is, in osteomalacia, what happens to the serum calcium level, phosphate level, and parathyroid level, and why? Now, firstly, osteomalacia is a qualitative bone disorder, unlike osteoporosis, which is a quantitative bone disorder. In osteomalacia, the key problem is that bone's quality is defective because there is impaired bone mineralization occurs. And it usually occurs due to vitamin D deficiency or resistance. Now, vitamin D deficiency, when it occurs when there is a low vitamin D level in this patient, that will result in decreased absorption of the calcium from the gastrointestinal tract, GIT. So that will be resulting in hypocalcemia, low calcium level, serum calcium level. Now that would result in secondary increase in parathyroid hormone level, which is called secondary hyperparathyroidism. So firstly, there is a low vitamin D, which is causing osteomalacia. That is resulting in low serum calcium. That is resulting in high parathyroid. Now, parathyroid has an effect on the phosphate level because it increases the excretion of the phosphate via the kidney. It's called phosphoturic effect. So that would result in low serum phosphate level. So understand the chronology. Low vitamin D, the cause. Effect is low serum calcium. Effect is high parathyroid, serum parathyroid, and effect is low serum phosphate. This is the order the things are happening in a patient with osteomalacia that you need to understand. Thank you so much.